also saying too much sugar and you're saying too low sugar, both of diabetic. Okay, both of diabetic, but the name is different. One is hyperglycemia, okay, high blood sugar and low blood sugar. We have blood sugar, but normal blood sugar is okay, but if it is going the range high, also diabetes, and low also the diabetes. Okay, so I will tell in details. Before that, here is the keyword. Okay, do you see the keyword? So the type 1 diabetes is known as IDDM, juvenile diabetes and adult diabetes. Okay, so you just understand this one. Type 1 diabetes is also known as IDDM and onset diabetes and adult diabetes. After that, next one is type 2 diabetes, also known as NIDDM. Okay, that means non-insulin dependent diabetes and maturity onset diabetes. Okay, so if you know this one, and in the further lecture it will be easy. And another one is glucose. Glucose means that this is the source of the energy of our body. Okay, another one is pancreas and islets of Langerhans. Okay, in our body, there is the around 100 grams pancreas. Okay, 100 grams pancreas. Okay, inside the pancreas there is the islets of Langerhans. Okay, so if you understand this one, and it becomes easy one. Okay, pancreas and islets of Langerhans, this is the most important organs in our body and playing the vital role in the diabetes. Okay, insulin and glucagon. Okay, insulin and glucagon. Insulin means most important things in diabetes that helps to bring the sugar, okay, from blood to the cells of the body. Insulin, the function of the insulin means it helps to push the sugar from the blood to the cells of the body. Okay, and glucagon means when we have too much of sugar, the storage sugar is called the glucagon, just opposite one. Okay, glucagon, you just understand. And another one is beta, alpha and delta cells. Okay, beta, alpha and delta means, beta means insulin produces the beta cells. Okay, and glucagon produces alpha cell. Okay, and delta means balancing condition. Okay, and then another one is hypoglycemia. Just I told you, glycemia, hypoglycemia and hyperglycemia. Hypo means low blood sugar condition and hyper means high blood sugar condition. Okay, I hope if you understand this one, okay, it becomes easy in further lesson. Okay, now just now I discussed about what is diabetes mellitus. If we go to the wisdom, historically it has came from the Greek word diabetian and Latin word mellitus. From here, that means the two pass through. Mellitus means sweetened with honey, and from the both words become the diabetes mellitus. The meaning is to pass through sweetened with honey. I hope you understand this one. Yes, this is from the Greek word. Okay, here are the, so we can define the diabetes with a different name. One is the easy name is sugar disease. Okay, sugar disease. Next one is, it is called hyperglycemia. Okay, next one is, it is metabolic disorder. Okay, when the age is going more, that time our metabolic rate is low, then it is a metabolic disorder. Then another one is, it is a silent killer. Why silent killer? Means slowly it kills, it disturbs the whole body. Okay, it leads to us towards the death. Okay, yes, it is very dangerous also. It is syndrome disease because it affects the throughout the body. This diabetes mellitus, it affects the throughout the body, that is why it is syndrome disease. And another one is, it is an imbalance in handling the energy system of the body. Okay, because energy we have, but we cannot balance the energy in the body. Okay, also this is. And another one is, it is the condition in which glucose level is higher than normal condition. Okay, so it's the condition where the glucose level is higher than normal condition is called the diabetes. Now in the picture, see the chart, you can see what is the range of diabetes mellitus. Okay, so here it is the fasting blood sugar. Okay, if you do see here fasting, yes, fasting. Okay, and the normal one is 80 to 100 milligram per deciliter. Okay, 80 to 100, and pre-diabetic is 100 to 125, and diabetic means more than 125. You got it? Yes. Okay, so if you didn't understand, just tell me. Okay, I'm going to read it now. There are two types of diabetes. One is type 1 diabetes and another one is type 2 diabetes. Okay, so how to define the type 1 diabetes and how to define the type 2 diabetes? Okay, normally in type 1 diabetes, what happens? Okay, what happens? Your pancreas does not produce the insulin. Okay, pancreas does not produce the insulin in type 1 diabetes. In type 2 diabetes, what happens? Pancreas produce the insulin, but the receptors of the body is not able to receive. Okay, you will understand this one. Then we can call the name with a different name. One is, see, in type 1 diabetes, IDDM, insulin dependent diabetes mellitus. Okay, what is that means? See, in type 1 diabetes, we have to give the external insulin to the client. Okay, if for them insulin is a mandatory, external insulin, because body is not producing the insulin. Okay, so if they want to live long, they have to take the insulin regularly. That is why insulin is mandatory for them. That is why it is called insulin dependent diabetes mellitus. Okay, and another one is in type 2 diabetes, insulin is not mandatory, so non-insulin dependent diabetes. You got it? Yeah. And another one is body structure is in type 1 diabetes, normally it will be thin, okay, or normal. Okay, and another one is type 2 diabetes, people look like obesity. Okay, people becomes like a obesity. And another is, what is the role of the pancreas? Here I already told you that pancreas produces the insulin in type 1 diabetes, and in type 2 diabetes pancreas produces but receptors does not use it. And another one is the role of the body is in type 1 diabetes, insulin receptors. Insulin receptors means body is receiving the insulin, but in type 2 diabetes body does not receive the insulin. That is why it is called insulin resistance. Okay, insulin resistance. You got it? If you don't understand, just tell me. Okay, okay, then another one is, see this diagram, you can easily understand from this diagram. Okay, see, in normal condition, the pancreas is producing the insulin. Okay, pancreas producing the insulin, and also the cells of the body is getting the glucose also. You got it? Yes. But in type 1 diabetes, see, pancreas is not producing the insulin, but the cells of the body is receiving. You understand? And in type 2 diabetes, pancreas is producing the insulin. Okay, but the cells of the body is not able to receive it. You got it? Yes. Okay, now we can turn next page. Okay, so mechanism of glucose in the body. So if you understand this one, it is mandatory to understand. Okay, normally whatever we are eating, see, whatever we are eating, it goes to the stomach. Okay, the final product is glucose. Okay, whatever we are eating, like proteins, carbohydrate, whatever we are eating, the final product is glucose. Okay, then after that, when the glucose is flowing to the blood, that time insulin is just close to the blood. Okay, close to blood, and it receives the glucose from blood to the cells of the body. Okay, cells of the body. Okay, did you see the picture of the cell here? Here insulin is working as like a key. Okay, key. See, and so there is the one like a blood pipe is there. So if there is the coming the mist like a glucose and insulin, open the door. Okay, go, and glucose is coming there. Okay, at that time insulin open the door and it sends the glucose to the cells of the body. And why cells of the body? Means if insulin is not sending the glucose to the cells of the body, glucose level will be more in the blood. Okay, more in the blood. And if it is not sending to the cells of the body, we are getting the energy. Okay, we are getting the energy. If it is not sending the glucose to the cells of the body, we don't get the energy. Okay, we don't get the energy. Then if we are not getting the energy, then how we can work? That is why energy, see here, glucose is mandatory. It is the source of the energy. Without glucose, we can't get the energy. You got it? If it is not sending the energy, if it is not sending glucose to the cells of the body, it only will be in the blood. Okay, only will be the blood. Okay, yes. So here you can see there cell, glucose and oxygen, engine, petrol and oxygen. So here you understand, in the body glucose is producing the energy in the presence of oxygen. Okay, glucose is producing the energy in the presence of oxygen to the cell of the body. Okay, same it is compared to like a engine. Okay, engine also needs petrol, yes or no? Engine also needs petrol. Okay, petrol in the presence of oxygen, petrol also generate the energy for the engine. Okay, then when engine is getting the energy, and from the engine whole system will run up, yes or no? Same thing in the body also, in the presence of oxygen, glucose produce the energy to the cell of the body, because cell is everywhere. Here on the hand also cell, brain also cell, legs also cell, yes or no? So main thing is energy is required for the cell of the body, because cell in own single hand, single finger, millions of cells is here. You got it? Millions of cells. So main thing is in the presence of oxygen, glucose produce the energy to the cells of the body. Like same thing, in the presence of oxygen, petrol also produce the energy to the engine. Okay, and from the engine whole system run up. Okay, yeah, this is the, I'm just going to analogy this one. Okay, till now any question you have? Are you understanding? Okay, so there is another global impact of diabetes mellitus. Okay, so this is the, I'm taking from the International Diabetes Federation. In 2017, 462 million were affected from diabetes mellitus in the whole universe world, and in 2021 537 million people were affected from diabetes. If the same range is going on, in 2030 it will be reached 643 million, and same range is going on 2045 it will be reaching 783 million people. Okay, these two are predicted. If we could not able to manage the diabetic, it can reach up to this one. Okay, yeah. Okay, then another one is here I mentioned the 10 countries, top 10 countries with highest prevalence of diabetes mellitus. You can see India, China, USA, Indonesia, Japan, Pakistan, Russia, Brazil, Italy and Bangladesh. These are in chronological order from India, China, US, like this one. Okay, so these are the top 10 countries with diabetic prevalence. Okay, then another one is developed countries and developing countries. Okay, developed countries also affecting, see, the burden of diabetes mellitus is rising globally faster rate in developed countries than developing countries. Okay, developed countries also have the more prevalence than developing countries. Yeah. Okay, so now let's discuss about the causes of diabetes mellitus. Okay, causes of diabetes mellitus. One cause is modifiable cause, that means we can change the risk factors, we can change it, we can change the cause. And another one is we cannot change the cause. Okay, we can change the cause, these are modifiable cause. We cannot change the cause, that is non-modifiable cause. So what we can change? See, you can change obesity, yes or no? Yes, you can change obesity. You can change physical inactivity. See, this is the cause, physical inactivity, but you can change it. So obesity, physical inactivity, imbalanced diet, pre-diabetic condition you can change, and stressful lifestyle you can change it. Okay, yes. From n non-modified cause means age you cannot change it, yes or no? Age, family history like genetic, heredity, ethnicity means like a region wise. Okay, you cannot change it. And gestational diabetes, after that history of polycystic ovary syndrome, okay, PCOS or other metabolic disorders, you cannot change this one. So these are the causes for diabetes mellitus. Okay, yeah. Here actually it is written on the Mr. left, but here is not in the black dot. Okay, so this is research based I am telling regarding to the obesity. Okay, regarding to the obesity, here mostly 50 to 80% people are affected from obesity, diabetic. If you are more obese, then you have more chance for diabetic. Okay, 50 to 80%. Yes. Then another one is, in obesity also there are two types of obesity. One is apple size obesity and another one is pear size obesity. Then apple size obesity is more dangerous than pear size obesity. Okay, you can see the picture. Okay, did you see the picture here? See, apple size obesity is here and pear size obesity. Why apple size obesity is more dangerous means this, especially this part, vital parts, abdomen, chest, lungs, liver, whole means muscles, fat, all means affected from here. Okay, everything is. So that's why this apple size obesity is more dangerous than pear size obesity. And in pear size obesity, only the muscles or fat will be on the lower part of the body, but in apple size, whole. Okay, middle part, mainly vitals organs part, middle part will be more obese. That's why in diabetic, apple size obesity is dangerous. Okay, then another one is regarding to the obesity. See, two parents, say parents have the two children, two parents have diabetic. Okay, two parents have diabetic and they have two children. Okay, two children. Then among these two children, when they are growing up at the age of like adulthood, one child is slim body and one child has obese. So this obese child has more prevalence of diabetes mellitus than normal. Okay, so that's why obesity is the main factor also for diabetes mellitus. Okay, next one is, here I am showing this heredity. Okay, heredity. One parent, if one parent have diabetic, have 25% chance for diabetes mellitus. One parent, either father or mother. If both parents have, 55 to 70% chance. Okay, if both parents have and coming one child also have, second child have almost 90%. Okay, diabetes mellitus. Okay, this is the comes from the heredity related. Okay, so then another one is peoples who are coming migrated from like eastern country to the western country, like South Africa, Fiji, UK, USA. Okay, European means there have the higher privilege, okay, who are migrated higher privilege than their own places. Okay, that's why heredity, this is the based on the heredity I'm talking. Okay, so I hope you understand this one. And here I want to talk about the stress related thing. Okay, stress, there are so many causes, among them obesity, heredity. Okay, and stress is also one of the main factors. Okay, stress is also one of the biggest and main factor for diabetes mellitus. Okay, and why means, see, before I was talking about insulin and glucagon. Insulin helps to reduce the glucose, but glucagon helps to increase the glucose. Okay, in stress level what happens, I will give the best example. Now I'm normal condition. When I got stress, that time I need more energy. Yes or no? That time I need more energy. And but I have limited energy. Now if somebody is saying me something bad things, or my boss is saying, oh Laxmi, you have to do this complete works within 3 days, that time I need more energy. That time what happens, my mind brings the more in a glucose level from glucagon, from the storage glucose levels. Okay, from glucagon. And so that I have already energy, and I am again taking the negative energy, glucose, storage glucose from glucagon, so that there is a more chance to increase the glucose level when you are more stressed. You got it? You got it? Yes. When you are more stressed, that time we need more energy. That time body, okay, brings the more energy from storage glucose, from glucagon, because you have already and more glucose level. So that's why when we are stress level, that time have a more chance to increase the glucose. Okay, this is the one factor. Got it? Yeah. Okay, so let's go to another side, symptoms of diabetes. Okay, yeah, here I'm mentioning two ways. One is hypoglycemia and another hyperglycemia. When we have low blood glucose, okay, that time there are some symptoms: sweating, shakiness, extreme hunger, nausea, fast heart rate, anxiety, fatigue, numbness of tongue, and loss of consciousness. See, normally you have to understand here, hypoglycemia, okay, hypoglycemia also one of the main danger condition. If, see, I'm last line, you can see, also it can lead to loss of consciousness, and you can be on the faint or seizure, you can go on the coma. But if you in your body have 50, okay, yamg, okay, milligram per deciliter, if you have 50 or more than 20 minutes, you can go on the death also. It can lead to death also, just 20 minutes. You got it? Because just 20 minutes, if you have very low blood glucose levels, that time cells of the body will be so hungry, so that when it is not getting the energy, it becomes like dehydrated. Okay, so it can lead to the death. It is a hypoglycemia condition when you have the low blood sugar. Yes, that's why when you have low blood glucose, so suddenly if you feel like this one, we can take something like a candy or sugar items or water, like this one. Okay, so it helps to generate the glucose fast. And hyperglycemia, the mainly is 3-1. Okay, 3-1: polydipsia, polyuria, and polyphagia. Okay, yes, this means excessive hunger. Excessive hunger, and excessive urination and excessive thirst. Like means you feel more hungry, and you feel more like a urination. You like to go to urine fast, and you like to eat as a drink water. Okay, so that's why polydipsia, polyuria, and polyphagia. Along with that, you may have headache and blurred vision. Okay, and fatigue also, weight loss also, and skin infection also, and slow healing condition. When you have too much glucose level in the body, okay, when it is cut on the any part of the body, it heals very slowly. Okay, it heals very slowly. It takes more long time because of the more glucose levels in the body. Okay, yes, these are the normally condition in the hyper condition of the glucose level and the hypo condition of the glucose level. You got it? Yes. Okay, now, so what are the complications? It gives the complication, like means there are the two main complications. One is the main complication and other complication. What are the main complication? The first one is neuropathy, okay, and nephropathy and retinopathy. These are the main complications. Okay, so nephropathy, see, that means it can affect to the, it can haunt, hit to the kidney. Okay, it can damage to the kidney also. It can damage to the kidney, and it can damage to your nervous systems. Okay, nervous system also. That is why it is called diabetic neuropathy. And another one, it can damage to the eyes also. So that is why it is called retinopathy. Okay, three thing is the main complication. Okay, nephropathy, neuropathy, and retinopathy. Okay, then other complication means like you can have like high heart disease. Okay, heart disease, heart attack, stroke, and along with that skin related disease. Okay, along with that you may have anxiety or the like bipolar disorder, anxiety or depression. Okay, along with that Alzheimer disease, like these things you can have. Okay, additional one, but main thing is neuropathy, okay, nephropathy and retinopathy. It can haunt, it can hit to your, it can damage to your kidney, it can damage to your like nervous system. Okay, and it can damage to the eyes. Okay, this is the main one. Okay, so another one is how to diagnosis for diabetes. Okay, there are the so many like scientific methods to diagnosis. Okay, how to diagnose. Okay, so one is a glycated hemoglobin, like a blood glucose level. Okay, it helps to measure the average blood glucose for past 2 to 3 months. Okay, one is glycated hemoglobin, and another one is fasting blood sugar, another one is postprandial blood sugar, another one is random blood sugar. Okay, these are the tests, okay, scientific methods to diagnosis. Along with that, OGTT, oral glucose tolerance test, and another one is urine, okay, urinary sugar test. Okay, these are the tests. Okay, from here we can find out either your diabetic condition, in which level you are and how level you are. Okay, these are the tests for the diabetes. Okay, and another one is, I will tell you very interesting thing in normally in the village area. Okay, in the village area, either you are diabetic or not, when you are passing the urine on the one place, okay, one place, and that times what happens after some minutes, okay, after some hours or after some minutes, so insects will be surrounding, okay, surrounding of your this urine, because insect, when there is the glucose like a sugar levels, very easily comes insect, ants. Okay, so in village area normally do like this also. Okay, so this is the normal local method. Okay, but we have to focus on that means, but it does not show that means the range, how range it is, like means too much or low or normal one. Okay, but it does not show, but it show only like means we have the sugar levels in the urine. But upper one is scientific methods for diagnosis. This is glycated, fasting blood, and postprandial, OGTT, urinary test. These are the scientific. Okay, we have to go on this one. Yes, any question please till now? Okay, now especially now Yoga can help, of course, but now it is being more scientific